Welcome to GNCC Espresso Live. My name is Mishka Balsom, and I will be your moderator for the next hour. The purpose of this series is to better understand how COVID-19 has impacted our lives so far and to start thinking about tomorrow. How will this pandemic have changed how we live, how we work, and how our societies will function? How has this impacted our corporate structures, employees, and customers, our business operations? And how will it reshape our collective priorities? It is critical for us to convene for conversations that encourage us to stretch our minds while determining how to best move forward. The decisions that we are going to make in the weeks and months to come will be the foundation of our recovery. Since launching our webinar series, we have spent much time on looking at the economic impact of COVID-19, the information and subsidies needed, tax and legal implications, municipal consequences, and we've heard from business leaders about the measures that they have put in place to strengthen their business. Today, our focus is slightly shifting by looking at the public health response and the mental health impact on owners, employees, and the community at large. While organizations and governments are preparing guidelines to reopen businesses, questions arise, both from a public health as well as a mental health perspective. To provide us with their expert view, we are joined by Siobhan, the Director of Environmental Health at Niagara Region Public Health and Emergency Services. Siobhan's team is responsible for inspections related to food safety, safe water, virus contingency response programs, personal service settings, daycares, and institutions. And during the current pandemic, she also wears the business continuity planning hat. And Dr. Maxine Lewis, Chief of Psychiatry for St. Joseph Healthcare Hamilton and Niagara Health. Dr. Lewis completed her medical degree at the University of Wales College of Medicine and completed her psychiatry residency training at the University of Leeds in the United Kingdom, where she gained her Masters of Clinical Psychiatry and dual specialist certification in adult and old age psychiatry. Dr. Lewis and Siobhan, thank you so very much for joining us. And thank you to all the participants. You are currently on mute, but we really encourage you to actually have a dialogue with our panelists. If you have any questions, there are two options that you have. You will see on the right-hand side of your screen a symbol of a hand. And by clicking that, we know that you want to ask a question and we will unmute you. Please watch for it. And the second option is called chat. It's a field where you can type the question and we can see it, and we'll do our best to get to it. Lastly, we had a high number of questions that have come in via social media or email, and we're going to start out with just one of them. So let's get started. Dr. Lewis, this one is for you. The strain of unexpected health issues, physical distancing, lost jobs, and closed business is taking its toll. In an Angus Reid poll released in April, half of Canadians said their mental health has worsened during this pandemic. Distress hotlines are reporting escalating numbers of callers, and an April survey of Canadians by the human resources company Monod Chappell found that self-reported measures of productivity and optimism had fallen steeply since the last lockdown began. Stress is rising, depression is deepening, and anxiety is spiking. Can you speak to some of those numbers, maybe numbers relevant to Niagara, and what are some of the most important and easy ways that employers can help the mental health of their workforce at this time? Dr. Lewis?
And I think the first thing to say is that we're all in the same situation. I think that everybody has had some level of anxiety regarding the changes that we've all experienced over the past 8 weeks. So I would say that it's perfectly normal and to be expected, really, for us all to have some form of anxiety and for it to have affected our mood in some way. So that's the first thing. I think that the other thing I would say is that as time's going on, I think we're all getting a sense that feeling that things are more out of our control, and we all feel that. But I think as leaders, we sense that in our workforce. I'm certainly seeing that in healthcare, that as more and more directions coming and changes are happening, it feels like things are out of our control. So I think the important things in and how we can all cope with this really and deal with it are firstly to acknowledge our own anxiety and to think about how we can improve our own mental health. And there are some really good strategies that I think can help me personally, but also might help you and might help your workforce. I think one important thing really is to focus on some of the things that you actually do have control over. So we don't have control over COVID, but we do have control over how we manage with that. So in terms of making sure that we comply with physical distancing, making sure that we wash our hands well, sort of complying with hand hygiene. And those are things that you can do as an employer, and those are things that you can enforce to your employees. The other thing that I think is important is to sort of make sure that you keep track of good news sources. So there's an awful lot of misinformation out there. I think we've all been aware of some of the Trumpisms, and of course the newspapers and the media focus on that because it's sensationalist. It's it sells news, but really we need to focus on good sources of information. So I would suggest things like the CBC, the Canadian government website, WHO, things like that, and ensure that the information that you're reading yourself and that you're providing to your employees is good information, is solid information. And when you're thinking about how you can cope as an individual, I think there are lots of strategies in terms of making sure that you limit the amount of news imbibing that you do. So try and sort of limit the amount of negative news that you read and focusing on good information. And also, I think just being aware of those help your physical wellness. So I think in all of the polls that we've seen, people are very much focusing on the bad news, but trying to focus on the good news, I think, is something that we can encourage people and will help your mental health overall.
We appreciate it. I think you're right. I think especially like your first point of when you spoke about just acknowledging that this is a very difficult time and a very different time, and seeing and recognizing how we deal with it. And I really appreciate you also mentioning the information sources that we listen to, because they do have, information has an impact on us and how we're dealing with it. And I think especially from an employer to an employee relationship too, I think it's critical, the message that is being sent on that end as well. So thank you. Siobhan, this one is for you. The province has committed to a gradual reopening with public health authorities watching for warning signs along the way. What are these signs, and how will we know if the reopening is going well or if it needs to be scaled back? Your expert input would be greatly appreciated.
Thank you, Mishka. Morning, everyone. Well, we do have a provincial framework with metrics to help to guide us. So surveillance, we're looking at sustained decreases in cases. We are looking to all of our contact tracing. So any case who has had people around them, so contacts of a case, we are reaching 90% of those contacts within one business day after hearing of the case. So that's assisting us. And as well to looking to ICU capacity as part of the looking to see how well we're doing. We're also working very closely with our local area municipalities, providing information, guidance, troubleshooting issues, and providing options. So as things do start to reopen slowly, there are a number of public health, infection prevention and control questions, and we are working closely with all the businesses reopening, and as I say, the local area municipalities to try to give as much guidance as we can.
Yeah, and I think this is really also something that employers are looking for at this point. For those businesses still open to the public and those about to reopen, what essential measures should be put in place to protect employees and customers? What are the recommendations that are coming forward?
Okay, thank you for that. Now, I just want to preface this by saying that on our website, niagararegion.ca/health/COVID, we have scads of information available to provide guidance. We have screening tools, we have questions, we have posters. So I just want everybody to know that that is available to them there. So with businesses that continue to operate, we encourage physical distancing. We encourage screening, so screening of customers and employees. So that's very important. It can either be an active screen, so actually somebody physically at the door asking questions, or it can be a poster at the front of the door saying, if you have these symptoms, don't come in. Physical distancing is key, and as well as hand hygiene. So providing alcohol-based hand rub, encouraging everybody to wash their hands as often as they can, and putting markers down on the floor if required, limiting the flow within the business, and as well too for employees to ensure that they're physically distancing. So looking at perhaps a situation of desks, no big meetings, canceling all big meetings, blocking off areas to discourage people from congregating for coffee, if you will. And so reopening, so businesses that have been closed for 8 weeks, 9 weeks, one thing that we strongly encourage is to pre-opening go in a couple of days earlier and do a very deep clean, if you will. Something too that people may not be thinking about, but the importance of actually flushing out the water lines. So you have a business that's had no water on for 8 weeks, let's say, so stagnant water. So open up all the taps, flush the system let every tap run for about 15 minutes to get the water running again, getting the new city water in, if you will. Again, too, signs, distancing, screening. The most important thing, again, is if an employee is ill, just to strongly urge them not to come to work. That's something that, one of the messaging. So again, too, physical distancing. If you're reopening now, depending if you're perhaps a food premise who there might have been some food left, certainly to be taking a very good look for any activity, uninvited guests that might have arrived over the past 8 weeks. So to check for any kind of pests or rodents. And, but to have a plan in place. How are you going to manage the flow? How are you going to screen people? How are you going to ensure that there's availability of hand washing for your employees and hand sanitizer for the customers? So those would be the keys. All high touch surfaces should be disinfected frequently. So if you know that there's a countertop or doorknobs, those are something that you should be planning on how you're going to maintain those using disinfectant regularly.
I appreciate this. Thank you very much, Siobhan. There is a quick follow-up question on this one. And the question is, are employers meant to supply employees with facial masks? Is it mandated that they do so?
It is not mandated. And that was one of our other questions. So face coverings, the best way to protect employees and staff and customers is physical distancing. So what a cloth face mask will do is to protect others from you should you be asymptomatic. That is the true function behind wearing a cloth face mask. So if people choose to wear them, but it is not a requirement by any means.
Okay, thank you very much. Dr. Lewis, this one is for you. It is from Benita White, and her question is, how can an employer best be present at this time for their team to offer mental health supports in ways that are open and inviting without being presumptuous or overstepping? It truly seems individuals are handling this crisis in so many different ways. Are there ways we can be there for people even though they might not be comfortable opening up or directly seeking help? And I think that's an excellent question. As we are connecting with our staff in different ways, we can't walk by their workstation. We often don't see them. We see them over Zoom, in video conferences now, or connecting with them via email as well. But over to you, Dr. Lewis.
Yeah, I think that's an excellent question. I think the first thing I would say is looking after your own mental health is important, because part of this is sort of demonstrating that you see mental health as important. And if you sort of demonstrate that by taking regular breaks, sort of demonstrating that you're exercising, that you think it's important, then your employees will see that and hopefully will follow suit. I think the other thing is, something I was saying earlier about providing clear information and direction, I think, and that goes to anything. I think to reduce anxiety in your workforce, it's really important to be clear in any direction you provide. And with regards to the question that Siobhan just had, just sort of letting people know what you're doing, I think will reduce anxiety greatly. In terms of how you can reach out to your staff, and I suppose the question really is how you can engage your staff. Really, there's lots of different ways, and I think that we've all seen the use of virtual technology, and the use of Zoom, WhatsApp, My Team. I mean, I'll give you an example. So I have a group of 5 medical leads that we've set up a WhatsApp, and we connect daily. I actually feel closer to them now than I did before COVID, because we're connecting so frequently during the day. And I think, I suppose it really depends on how large your workforce is. But as you do sort of come together again, obviously sort of complying with physical distancing and all the other good things that Siobhan has said, thinking about ways that you can bring mental health into the workforce, whether that's encouraging people to go out for walks during their break, making sure that there's plenty of water available, making sure that people have nutritional breaks, things like that. Simple things, really. But one thing that we do in our organization at St. Joseph's is we focus on mindfulness, and that's some people can actually find that a little bit off-putting, but even just sort of encouraging people to look at mindfulness websites and think about just taking a breath. I mean, that could be a mantra: just take a breath, just pause, just think. I think those are sort of some simple strategies that I would consider. I think that's answered the question.
I think it did actually too. And I thought I wanted to come back to the first part, because it ties into another question that we had received from one of our attendees. And you mentioned at the beginning that one of the most important ones is that maybe the employers or the managers are becoming like a role model for the staff, that they see that you're taking a break, that they're seeing that you're having a healthy exercise regime, or maybe nutrition, or that you seek help as well. But this leads into this question where business owners have been working day and night to ensure the survival of their operations, maybe not stopping to think about monitoring their own health in diet, exercise, or others, just because of the struggle and the fear that they're going through. What are the warning signs that we might need change and that we're doing what we're doing, or to seek help? What are the warning signs that people need to look out for? And I think that probably helps from an employer's perspective, but it probably helps from an employee perspective at the same time.
Yeah, no, I think that's a really important point. And the messaging that I've been giving is really, it's about this is a time for self-compassion and for self-awareness. So I think when we're thinking about our own mental health, one of the important things is really to be aware of where you're at. And often mental health can actually affect your body first. So we've all had that sense when we're about to do some public speaking where we have, we feel a little bit keyed up, we feel a little anxious, and lots of people are actually feeling that more often than they would have done, especially with all the stresses that people have right now. I think that so being aware of that really, and as I said, we all have that. We all, this is normal. We all feel anxious. We all maybe sometimes have a sensation that our heart is beating fast, or we maybe have a dodgy tummy. It's when those symptoms persist, it's when you don't really get a break from it, that's when I would say you really need to pay attention to it. And initially I would sort of think that you really need to take a pause. You need to relook at what you're doing. Can you take a break? It might not be feasible, but can you focus on your hydration? Can you look at your diet? Can you look at your exercise? Are there things that you can do? Can you maybe take a little bit of time just to do something that you enjoy, rather than constantly looking at the books, constantly thinking about the stress that you're under? And I think if those strategies don't work, that's really when you need to reach out to firstly your family doctor. There are also some really good online resources now, and I don't know whether you want me to share those with you now, or whether I could add them together and you could send them out later. There's a few websites and things that I would suggest.
That's a great idea, because
Okay.
what we do for all attendees, we will provide them, this webinar is recorded, so we will provide them with a recording of it following that, and included in that we can add the resources to it. And because we also post our webinars to our website, we can also look at some of those resources at that time. But Dr. Lewis, are there one or two of the resources that you would really highlight and saying like they are must-go places when employers and employees feel the amount of stress is not letting up?
Yeah, so the CMHA websites are great, and there's also Ontario Health has some really great information specifically around COVID-19. So when I said before about good resources, that's a good one to go to, but it also has links to lots of mental health strategies, and also virtual care as well, because with the government funding, we've got some additional funding for free therapy, free counselling. So there's lots of good resources out there. Another one that I would suggest is called bounceback.ca, and that's another free resource. It's actually virtual cognitive behavioral therapy, which goes back to what I was talking about before, the way that sometimes the way you think affects the way you feel.
Yes, that's so true. Thank you very much. And
Okay.
We most definitely will pass it on to the attendees. And what we always find with all of our webinars, there is a high number of people that, because of the time we hold them, might not be able to join in, but the viewership is afterwards is really where we see the uptake on it, and we will include the resources. Shannon, this one is for you. It's from Ann Dixon, and her question is, any idea when caterers will be advised about new regulations for protection of food and utensils at events, i.e. things like sneeze screens? Over to you, Siobhan.
Right, thank you for that. There are some resources that have already been produced by the Ministry of Health that address some of those. I would suggest, we don't have clear definition just yet, but I would suggest that on a go-forward basis, any type of contact with food is going to require increased utensil use. We are going to be seeing, I would say, an elimination in our new normal of anybody, let's say catering or at a salad bar, where anybody can actually touch the food. I would say that that would no longer be accepted. So I would look for increased use of sneeze guards, absolutely. Increased use in utensils, increased use in hand washing again. I think that's all going to be our new normal.
Yeah, I agree with you. Can I, and this is a related question that has come forward from one of our members, and it's asked, how long does the virus live on surfaces? What are the safe handling rules for mail, packages, deliveries, and so forth?
Right. Thank you for that. It's not certain how long COVID-19 survives on surfaces, but it does seem to behave like other coronaviruses. So from that, we can suggest that the virus may live on surfaces for a few hours up to several days, depending on temperature, surface, and the humidity. Mm-hmm. So again, high-touch surfaces should be cleaned and disinfected regularly, cleaning your hands. The one thing that we do know is that parcels or packages coming through the mail service have been in trucks or have been away from anybody handling them as they are transported through. But again, too, what I would suggest is after handling anything, any type of package, to ensure to do 20 seconds of really aggressive hand wash.
Yeah, I appreciate that. And that is very helpful, because I think we've all had parcels coming to our house or things being delivered over curbside pickups. We've taken a part in to support local businesses, and how do we deal with it? I appreciate that. Dr. Lewis, this is a question probably for you. With so many people working from home, the lines between work and home life are increasingly blurred. And there's a likelihood the weeks or months to come as employers might find that they don't need their offices as much or as big as what they have had in place previously. Can you comment on the importance preserved when offices are closed and when people are working out of their homes?
Yeah, absolutely, and that's another good question. And I think we've all found it that with the increased use of telecommunication as well, it seems that we can't turn off as easily. It's the same with email. We're always at work. I think some strategies that I found helpful. So one is to sort of keep a regular routine. I think it's very easy when you're working from home to sort of get into the habit of not sort of thinking that you're at work, and that sort of blurs the boundaries. So getting up at a regular time in the day, maybe wearing something that makes you feel as if you're at work to sort of help denote that this is work now. And the other thing that I found difficult in the sort of rare days that I've been able to work at home is that it's more difficult actually to take breaks. I think when you're at work, it's easy to sort of take some breaks and have a little chit chat. Whereas when you're working from home, it can be very easy to work 12 hours straight, I think, without a break. So even scheduling those regular breaks for yourself, and those things that I said before, making sure that you have nutrition breaks and taking a little bit of exercise. I think when people are working from home, they might feel a little guilty perhaps about taking some time to themselves, but I think it's really very important. And then I think at the end of the day, having some little routine that you go through to denote that you've finished your day, and whatever that takes. I mean, having maybe a regular spot where you do your work, and putting it away if it's in the kitchen or something. But if you have a regular office, closing the door, saying, okay, I'm at home now. Even some people go through a sort of routine of changing their clothes to sort of denote that they're at home. Maybe some people might find that a bit daft, but you know, whatever works for you. I think the other thing that I think is really key when you're working from home and trying to find that balance is finding that connection. So I think for people who are living with other people, with their families, perhaps it's not so much of an issue, but it might be an issue with connecting with people at work. So trying to sort of schedule those times during the day when you can link in, you know, try and sort of promote that team sort of mentality that perhaps, you know, working individually you tend to lose. And then for those living alone, I think non-work hours, making sure that you actually schedule some time to connect with other people in a fun way rather than just in a work way. So those are some strategies that I would suggest.
Yeah, and I actually really appreciate your tips, because I think you're right when it comes to our routine that we have set up, even the space that we have set up at home. I have just personally, on a personal note, is I can't, if I open up my work laptop, then I'm working. So I can't even do anything else on it. I have to really leave it, close it, put it away on a shelf, and then I don't touch it. But any other way, if I open up, it's like I'm working. That's really, it's just because it's that laptop and it's my association with work. This is a question related to it. How do we deal with loneliness and replacing the daily interaction with our coworkers for those working from home? And I think you've touched on it a little bit by speaking about connecting with people, non-work people and others. But do you see, is the sense of loneliness increasing with people? And if people are on their own, don't have a family or partners or others around them in their household, how do they best deal with it?
Yeah, and I think we've all heard the phrase social distancing, and how that's sort of changed now to the message that this is physical distance, that actually we need to comply with physical distancing, but we need to really reinforce the social connections. And I think it's part of it is related to whether you live with other people or not, and part of it is related or how you cope with it is related to how your age and where you're at, your stage of life. So I have young adult children who have come back to live with us after university, and I found that they're actually managing very well because a lot of their social connections are virtual anyway. But what I'm hearing is that some younger people are having more issues, obviously because of the sort of financial ramifications of not being able to work. So that's had an impact. And I think it really, how you sort of get around that sense of loneliness and connection can happen in different ways. Like I said, some people are managing by arranging groups for work and groups for social life, such as Zoom, etc. Some people we're finding are really focusing very much on their creativity. You know, the fact that we're running out of bread and yeast, I think, is something that sort of speaks to that. And I think the other thing that we've seen in mental health is that art and creativity and music can really bring people together as well. So sort of trying to sort of focus on that. And that, I suppose that goes back to some of the things I was saying earlier about trying to find the joy in your life, trying to focus on the things you can change rather than the things you can't. So having joy in certain aspects of your life rather than focusing on, oh my gosh, I'm on my own, I can't go out, I can't do the things that I used to be able to do, because there's other things that you can do and you can focus on.
No, I appreciate that. And I think it's good for us to remind ourselves of that. And if we're reminded of it, then we live it and we show that to other people as well. Siobhan, this one is for you. And this is a question that probably a lot of businesses have, but employees at the same time. How likely is the second wave and the second subsequent economic shutdown and a health situation that we are going to deal with? As you're preparing in your field and in your expertise, are you preparing for a second wave? Do you advise businesses need to prepare for it? And if yes, how do we move forward with it? This is a loaded question. A broad question, but I think it's something that businesses are curious about. So
yes, yeah, thank you for that. If only I had a crystal ball. So part of the rationale behind the go slow approach with reopening in the province is just that very issue, that let's monitor, let's see how it's going. We have a very good surveillance system. We are doing all kinds of testing in Niagara. So anybody with any of the symptoms, and the list of symptoms keeps increasing, so you could go for testing. So we're doing a lot of testing, we're doing monitoring. We are monitoring through Niagara and through the province to see where the case count is. So in Niagara, when we first started our full-blown emergency operations center, our doubling time of cases was 2 to 4 days. Yesterday, our doubling time is, I believe, 67 days, which is fabulous. So there's the flattening of the curve that we're looking for. There is no, we have now increased testing opportunities, abilities, increased lab testing. So we are doing everything that we can to monitor, and really that is our only tool to make sure that we don't see a spike again. We have seen in other areas of the world that when they've lifted restrictions that there have been spikes. So this is why we're trying to enable and to empower businesses to open their doors in a modified way. But again, it's the physical distancing, it's the hand hygiene, it's the screening, all these things that are so important. So I definitively say there won't be one or there will be one. I cannot, but I can tell you that we're doing the best that we can to monitor, to ensure that if we see any spikes, we'll be able to kind of address them whatever way that might be appropriate.
yeah, and I think this is, I think you're right, because we can't say if it will happen or it won't happen. But I think that one of the things we've all learned is that we have to be prepared that something will happen. And I think that we have, in many ways, I can say this for businesses, we have had a great focus on being very efficient over many years, but maybe a lesser focus on how to be resilient in crises like this. And I think if organizations are learning anything, it's that we're now looking at them and saying, how resilient are you to future crises that we might all have to deal with it. There's a question, and it is for you, Siobhan, but it's currently the health data, and congratulations on really flattening the curve so successfully. There's health data for the region of Niagara that is brought, but less by municipality. And some people have contacted us and saying, like, can we get municipal specific data on that? And I was wondering, there is probably a reason for it, or is it available? Is there something that people can turn to, or is it just that it's grouped and pooled together because we really have the two major sites as being St. Catharines and Niagara Falls that are dealing with the crisis? Over to you.
Well, yes, we do. Excuse me. Originally, we were reluctant to release any data, excuse me, by municipality for fear that it might identify somebody. Mm-hmm. So, when we only had our first few cases. So very much wanting to protect the privacy of the individual who was ill with COVID. As well too, a lot of the data by municipality might not be significant in the fact that 52% of our cases approximately are related to outbreaks in long-term care facilities. So if we have a long-term care facility that's an outbreak with many cases in a particular municipality, those numbers would be higher, but it might not be truly significant, if you will, of what the general population looks like, if that makes sense. I do know, our long-term care facilities are our most vulnerable, and the province has had a very aggressive, if you will, screening, sampling, testing program in place. So by week's end, we will have tested all long-term care facility residents and staff in Niagara. So we are really hoping that will give us a significant reflection of what's going on in the long-term care facilities. And again, those are a big spike in our cases. So I hope I've answered the question.
I think you have. I think that people have the right for privacy, and that early on that needed to be protected. And I think it's also, I think the issue with long-term care facilities and homes is critical in how we look at all the data that we have. Dr. Lewis, millennials who came of age during the 2008 recession are already struggling with student debt, high housing costs, and limited job prospects. Now they're facing a second downturn just as they're buying homes and having children. The question leans towards, do different age groups or generations deal with this differently? Do you see anything as you're looking at that, maybe even during, I don't think it's comparable to SARS, but do you see any impact on different generations that are coping with it differently in ways that it might also help an employer to support their workforce?
Yeah, I think so. Certainly, there is a difference in how different ages sort of manage this, and it's really dependent on where you're at in life. And I think I spoke a little bit to that in terms of how my own children are coping with this, as opposed to how the rest of us in the household are. But certainly in our youth, we're seeing a lot of feelings of anxiety regarding isolation, even though people are typically sort of, I'm talking about late teens, early 20s, they're sort of much more aware of and much more sort of linked in terms of virtual technologies. They're still feeling that sense of isolation, and as you get older in that sort of 20s, 30s, I think we're seeing a lot of the distress, as you said, caused by dashed hopes. Really, there's a sense of loss, there's a grieving, and there's also a feeling of loss of control, which I spoke to earlier. I think we're all feeling that, but I think certain at certain stages in your life, it's already pretty chaotic. If you have young children and you're just starting out, perhaps, you've got the added stress. Plus, you've got people that are dependent upon you, which is, even more stressful. So, and then as people are aging, I mean, I'm a geriatric psychiatrist, so I see a lot of our seniors are actually dealing with just practical issues, just trying to be able to get groceries, things like that. So different ages have different stresses, and I'm thinking more about the workforce stresses. It's more around financial stress. It's around dependent stress, and I mean, there's not a whole lot we can do about some of that, but I suppose it goes back to what I said about before, is really trying to focus on the things that you do have control over, rather than getting your head spinning over all the things that you can't have control over.
Yeah, it makes sense. Now, we can almost, I don't know if we can make this assumption, but we can probably, maybe we can, but say if we would make the assumption that due to COVID-19, more Canadians will suffer from some mental health consequences based on the stress that they're experiencing, possibly the loss of a job or the uncertainty of that and other aspects of it. And they might need help from a mental health care system, somewhere where they can turn to because they're overwhelmed. But the system itself, the mental health care system, even prior to COVID-19, was already overwhelmed in managing the demand on the system that was there. Is there a place for virtual care, telepsychiatry? Are we seeing opportunities that we maybe are saying there is a higher need to support Canadians' mental health, and we need to look at different ways of providing those services, similar to what we are likely going to see with our family doctors?
Yeah, no, absolutely. And I think the good thing about COVID, if I can say that, is that it's encouraged us to think differently about how we're providing care. And certainly within a week, we had switched in Niagara Health and in Hamilton, had switched our outpatient services to sort of 80% virtual care. So, and we know that the province has also actually provided additional resources for virtual care. So Bounce Back is one of them. And I think that as time goes on, we'll have a more investment in virtual care. I think, and virtual technology, I think, is good up to a point. There's lots of things that we can do virtually in terms of counselling, assessments, things like that. But we're also very aware that there's going to have to be some capacity for one-to-one visits as well. And absolutely, we're in the process of looking at how we're going to provide mental health care in this new world. I mean, what Siobhan was outlining in terms of, giving your clinic, giving your business a deep clean is essentially what we're looking at in terms of, okay, what do we need to do to make sure that people can come back to our clinics safely? Yeah. And how are we going to provide some care virtually and some care sort of face-to-face?
Yeah, I think in a genuine effort to being able to deal with as many patients as well we can likely will be able to deal with, and we really appreciate it. On the question of deep clean, Siobhan, there is, I know you touched on it early on in our webinar, but there is a question from one of our attendees. What do business owners need to do in the days leading up to the opening of their business? What does it look like day 2, 3, 4? Prior to it? You mentioned at one point the deep clean of services and preparation for the space. Are employers meant to hire someone, a company to do it professionally? I don't know if you want me to clean our office. I'm just not sure if I'm good with it. Are they, and I'm not sure if the regular cleaning staff is prepared for it either in some of the cases. What should employers look for?
I wouldn't say that it would be necessary at all to hire somebody to do it. I think it's certainly something that an operator owner could do. Again, there's lots of information on our website, but it's getting cleaning products, it's cleaning, it's sanitizing, disinfecting, making sure that the cleaning products actually have a DIN, drug identification number on them. Another thing that's important is that alcohol-based hand rub should be 70% or more in order for it to be effective. There are a number of them out there, kind of 60%, 65%, but it has to be 70% or more in order to do the true kill of the germs on your hands. I'm suggesting to operators, as I say, so depending on what your business is, if it's a food premise, did you leave and maybe there's still some residue of food there? So when I say deep clean, I'm suggesting all surfaces, taking a good look too at all surfaces. In the back of your mind thinking, oh, that countertop is kind of a high touch area. So I'll have to remind myself that, every day, 3-4 times a day, I'm gonna have to clean that. Providing the right cleaning materials for the cleaning staff. If you do have cleaners, perhaps in the evening, but really kind of your first day in, take a look around and say, okay, haven't been in here. Again, the water, get the water running and let the flush go and get the old stagnant water out. But then room by room, clean, disinfect, sanitize, all, high touch surfaces, as I say, that's the kind of key. And then, kind of wearing your hat thinking, how am I going to do it? So day one, you're in there and you do the clean. Day two, you go in and think, how am I going to control the flow of customers? Where are they going to go? How far apart do they have to be? Maybe even to the point of putting, tape on the floor. So we actually here at Public Health, we have huddles in the morning and there's tape on the floor to tell you where 6 feet apart is so nobody stands close to each other. So kind of put those measures into place prior to opening. So it's the cleaning, but it's also the looking ahead at where am I going to put up my sign that says to customers coming in, if you've been out of the country in the last 14 days, if you're exposed to somebody with COVID, if you have any of these symptoms, so that kind of forward-thinking prior to opening a business.
Yeah, I appreciate that. Can you take a moment to take a look at under what conditions should an employee be told to stay home?
Okay, thank you. We have a self-screen before any employee enters the building here at Public Health and for all of Niagara Region. But what we're looking for is to be asking employees, have you traveled outside of the country in the last 14 days? Have you been exposed to anybody who is COVID positive or conversely who is being tested for COVID? Do you have any of the following symptoms? So we now have a list of symptoms that have increased from when we first started, but it's fever, it's new or worsening cough, it's obviously temperature, nasal drip that's not related to allergies, and additional ones that are relatively new, so fatigue, feeling unwell. So as I say, all of those symptoms and signs are available on our resource page at niagararegion.ca. If employers would like to download those resources, they're all there for them.
Very good. Dr. Lewis, how can businesses, now that they likely will open up again, they might be dealing with more customers, and customers who are stressed and angry due to the physical distancing rules, closures, or products and services not being available, or just a general situation, just a heightened sense of being anxious and maybe responding in that way? What are some good calming and coping strategies that maybe would be helpful for employees and employers to know while dealing with the public?
That's a really good question. And I think it goes back to some of what I've said earlier in terms of looking after your own mental health first. Because if you're coming from a good place, if you and your employees are in a good sort of mental health space, then you're going to be able to cope better with someone who's distressed. And I think so it's really sort of understanding what the distress, where the distress is coming from. So some people will feel distressed because they're worried about the risk of contracting COVID. So I think all the measures that Siobhan's talked about, sort of making sure that it's very clear what you want people to do, and clear communication is always really helpful, making sure people know ahead of time what they need, what they're going to expect, that there's going to be wait times, etc. And I think if you are dealing with someone who is very distressed for whatever reason, really listening to that person. I mean, it's sort of pretty sort of common sense stuff. You know yourself that if someone isn't truly listening to you and doesn't hear your concern, then you get more upset. Well, I do. I get more upset. So actually listening to what the issue is, because sometimes the issue isn't actually what seems to be superficially the issue. Sometimes the issue is that somebody's waiting because they maybe have a child who's waiting at home or some other stress. So actually taking the time to listen to that person and try and sort of acknowledge that distress, and then to very clearly state you know, what you're doing and the limitations that you're under. That's not going to help in every situation, I'm sure, but I think that the most important advice I would give is really looking after your own mental health before you come to work. The other thing that always helps me when I'm caring for someone who's very distressed is to just check in with myself first, to take a breath, to pause before I answer, and just acknowledge where that person is coming from. It goes back to that, and again, it might sound a bit Pollyanna-ish, but it's about that sort of feeling that self-compassion for yourself, recognizing that you can't answer everything. You can just answer what, you know, you can just be honest and answer to the best of your ability.
Yeah, I really appreciate that. And you're absolutely right. And we're close to the top of the hour. And so I ask each panelist, if you have a minute for some closing comments, that you would want to leave our attendees with, that might be helpful for them. Dr. Lewis, if I can start out with you.
So I think the most important thing that I would stress to business owners is that that self-care piece, really making sure that you take some time now and in the future, because this is ongoing. This is going to be an ongoing stressor, and it's different. It's going to be different today compared with how it was a week ago, how it is in a week's time. So really sort of checking in with yourself, and sort of even just if you feel comfortable sharing that you're doing that with your employees. So acknowledging the importance of good mental health. And I will send out the resources that could be helpful to you or your employees.
I appreciate that very much, and we will share it with them. And Siobhan, your closing comments?
Thank you very much, Mishka. Well, I would like to share that you know, probably best case scenario, we might see a vaccine next fall. Perhaps before that, antivirals, but you know, we don't know. And until such time as we have a vaccine, I don't believe that we'll ever go back to our old normal. So our new normal is what it is, but we at Public Health are here to, you know, assist all of the business owners and premise owners in Niagara. So please do feel free to reach out to us. As I say, our website has got a host of resources for you. And we're just here to try to help everybody through this situation. Thank you.
Thank you so very much. Thank you to both of you, Siobhan and Dr. Lewis, for being with us this morning. This has been really helpful. One of the things that I notice is the importance of actually our community connections that we have. I think we see the public sector and the private sector working and collaborating more and coming together and actually helping each other like through this situation. And I'm really encouraged by that. And if anything gives me hope is actually seeing the kindness that is directed towards our co-workers, the kindness directed towards our neighbors and those most vulnerable and lonely in our communities, and the compassion that we have for those who are under tremendous stress at this point in time. So I I think if anything good comes out of this situation is I think that we are learning more, that we are all in this together and we depend on each other. So thank you for being with us this morning. Today's webinar has been recorded and will be available on our website at gncc.ca and will be emailed to all participants directly, along with the resources that both panelists spoke about today. There's a few other resources that were mentioned today. Please feel free to check out our website for a complete list as well. And if you have any direct questions on how to access some of it, please feel free to reach out to us and we will direct you to the experts that can help you out. Many companies do have a benefit plan, an employee assistance plan and program that is there. Members of the chamber have access to a chamber insurance plan that offers many of those programs and benefits. And if you need any more, if you have any questions about it or require some information, just let us know. Lastly, to all participants, thank you for joining us. Please stay in touch and above all, stay healthy. Thank you.